from the back and drive you wild. Girl, I lose myself up in those
Good day, I am Arlene Salvador, third year student nurse from Nueva Ecija University of Science and Technology. And today, I will demonstrate a procedure on providing a tracheostomy care. The goal of this procedure is the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. For the equipment, check for bedside table, towel, tracheostomy suction supplies if necessary, sterile tracheostomy care kit if available. Be sure to collect supplies listed that are not available in kit, or 2 sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, pre-cut or sewn surgical dressing, sterile basin, small sterile brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves 2 pairs, mask, goggles or face shield, hydrogen peroxide, and plain NSS or sterile water. First, bring the necessary equipment to the bedside stand or overbed table. Then, perform hand hygiene and put PPE if indicated. Next, identify the patient. There are many ways on identifying the patient, using door tag name, wrist tag, and bedside name tag. Next, close the curtains around the bed and close the door to the room if possible, to provide privacy to the patient. Next, determine the need for tracheostomy care. Next, explain what you are going to do and the reason to the patient, even if the patient does not appear to be alert. Good morning, ma'am. I am Arlene Salvador, student nurse from NUST. Today, I am going to provide tracheostomy care to you to maintain the patency of the tube and minimize the risk of infection. Next, adjust the bed on a comfortable working position, usually elbow height of the caregiver, and lower side rail closest to you. Note that if the patient is conscious, place him or her on a semi-fowler's position. And if the patient is unconscious, place him or her on a lateral position, facing you. Next, move the overbed table close to your work area and raise to waist height. Next, check for the lung sound. Next, place the towel below the trachea site, covering the neck and the chest of the client. Next, put on face shield or goggles and mask, and suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove soiled site dressing and discard before removal of gloves, used to perform suctioning. Next, prepare the basins and cleaning solutions. Mix sterile water or plain NSS and hydrogen peroxide in one basin, 50-50. Be sure it will fill 0.5 inch of the basin. Then, add another plain NSS in another basin. That will fill at least half inch. After that, perform gloving. Remove the oxygen source if one is present. stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Then, grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release lock. Then, gently remove the inner cannula and place it in the first basin with plain NSS and hydrogen peroxide. Let it submerge for a few minutes. Simultaneously, gently slide the tracheopad or dressing downward and discard. Then, check for some exudates or drainage, skin breakdown, irritation, and inflammation. Next, clean the inner cannula of the tracheotube using the prepared plain NSS plus hydrogen peroxide and use brush to remove solidified and sticky mucus. Next, rinse the inner cannula using the second basin with plain NSS. Then, discard gloves and put other gloves if necessary. Then, dry the inner cannula using the sterile gauze or pads. Then, gently reinserted it to the tracheostomy tube. Be sure it is locked properly. Next, dip cotton tip applicator or gauze sponge in a cup or basin with sterile saline and clean stoma under faceplate. Use each applicator or sponge only once, moving from stoma site outwards. Then, pat skin gently with 4x4 gauze sponge. Next, slide commercially prepared tracheostomy dressing or free-folded non-cotton filled 4x4 inch dressing under the faceplate. And check for the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Next, remove gloves. And assist the patient in a comfortable position. Next, raise side rail and place the bed in the lowest position. Next, remove additional PPE if indicated and perform hand hygiene. Then, document the procedure. Next, reassess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sound. Then, document the result.